Followed by Jamie Green.
Thanks very much, Presiding Officer. Only last week I spoke in a Labour health debate on local services, which in itself was a bit ironic, but today it's something else. We are here to debate on a so-called national health crisis. I should take the opportunity really to check if this debate is not meant for Westminster. And I needed to check as a crisis and no confidence from the motion as the words being uttered by patients, families and professionals in regard to the current situation in the Tory-run NHS England and its colleague Jeremy Hunt. However, hold the presses. The Tories had come across a report showing, according to Ruth Davidson, Scotland's NHS is facing pockets of meltdown. This report linked it to an article that hospital accident and emergency performances is now the worst it has ever been, and that, in another story, we ended the last financial year reporting the largest deficit in the NHS history. Doesn't sound good at all for Scotland. However, as the Cabinet Secretary said, out of the 94 hospitals used in the report, only 3 were from Scotland, namely Aberdeen Royal Infirmary, Nine Wells in Dundee and Rigmore in Inverness. But what the Cabinet Secretary didn't say, when it comes to the accident and emergency performance, the relative statistics for the referred Scottish hospitals areas are NHS Grampian at 96.7%, NHS Highland at 97.5%, and NHS Tayside on a phenomenal 99.2%. 99.2%. Nationally, the core of the A&E services for Scotland overall in June was 95%, compared to the under 86% in Tory-run England and under 79% in Labour-run Wales. Overall, Scotland's core A&E departments have outperformed the rest of the UK for the last 17 months. In regards, you would have a cheek. Oh, sorry, no, I take the. Sorry, my
Alex Cole-Hamilton.
I mistook you for a Tory. Carry on.
That's never happened before. Thank you. I thank the member for giving way. Would the member please tell the Chamber how this constant misdirection as to what is happening in other parts of the United Kingdom should make up for the fact that there are patients languishing on waiting lists and in hospitals in the jurisdiction in which you have been in power for the past 10 years?
Gil Paterson.
Well, I think the colleague pointed out, thank God it's us that's in power, to be quite honest, because under your record, that's the stats I'm actually quoting. You know, it doesn't matter what performance indicator you want to look at. This government outperforms anybody, including your own, to be quite honest. In regards to the aforementioned deficit, when you visit the actual story, the headline reads NHS hospitals in England reveal a £2.5 billion record deficit. The original references to meltdown is targeted at Tory-run NHS England, but here we are debating a report that has no relevance in Scotland. From the motion, I agree, and I sincerely agree, to commend the staff across NHS Scotland for their hard work and dedication. During the terms of this government, we have seen our staff ensure our hospitals are cleaner and safer. There have been major reductions in the number of hospital-acquired infections since 2007. Cases of C. diff in patients aged 65 and over have reduced by a whacking 86%, and cases of MRSA have reduced by 87%. NHS Scotland has one of the safest healthcare systems in the world, with record low infection rates and an internationally recognised patient safety programme. In regards to investment in primary care, I'm proud to say my own constituency has benefited significantly as big investments in the Golden Jubilee Hospital. And as a result of a tremendous effort on many people, the previous Finance Secretary, who played no small part in this effort himself, was able to announce not only that a new much-needed health centre in Greenock, which is not in my constituency, will be built, but that, as part of a combined capital investment of £38 million, a new Clydebank Health Centre will be built, which is in my constituency. No thanks. And this will allow the continuation of community health services in Clydebank. And with mental health provision high on this government's agenda, I understand from NHS Greater Glasgow and Clyde that primary mental health services will form part of the new health centre. And as the focal point of primary health care in Clydebank, this, for me, only adds to the importance already shown by this SNP government. Despite these positive results and steps from NHS, Tories both here and in Westminster, through narrow-mindedness and self-worth, have taken Scotland into uncharted waters, with approximately 1 in 20 of NHS Scotland's doctors coming from elsewhere in the EU. The Tories are managing to threaten our NHS not just through front-door cuts to Scotland's budget, but via the back door using Brexit and threatening the ability to recruit health and care staff in the future. To conclude, Presiding Officer,
please.
I think this debate from the Conservatives is a bit rich, and I do think there is a considerable dose of brass necketry calling this debate on health today. Presiding Officer, I commend the Cabinet Secretary's amendment to the Parliament. Thank you.
May I remind members that in all contributions they should speak through the Chair, and I call